Good morning, teacher. My presentation amoxicillin for community-acquired bacterial pneumonia. Definition: amoxicillin, a new antibiotic agent of aminoxicillin that is administered once a day and can be administered intravenous or orally, is its activity against pathogens that cause pneumonia. Below a video.
Hello, in this video we're going to talk about community-acquired pneumonia, or CAP for short. This is an overview and introduction. So community-acquired pneumonia is pneumonia acquired outside hospital in a person who is not immunocompromised. The choice of antibiotics is usually empirical because the etiology or the cause of the pneumonia is not known for at least 48 hours after admission. And severity of the pneumonia is considered using the CORB or CURB or the SMART COP, and this is used to determine severity. So in summary, what to do with community-acquired pneumonia? It's important to assess, stabilize the patient, take a history, examination, chest x-ray, and remember to take oxygen saturation. The clinical presentation of pneumonia include chest pain, dyspnea, a wet cough or a dry cough, fever, and headache. Looking at a lung with pneumonia, it can present as either infection, inflammation affecting a lobe of the lung. This is known as lobar pneumonia. Or the inflammation, infection can affect patches throughout the lungs within the airway itself, and this is known as bronchopneumonia. These findings might not be visible on the chest x-ray, and it's important to know this. So let's look at the functional units of the lungs, which are the alveoli. Normally alveoli are clear. They allow for exchange of oxygen with carbon dioxide. In lobar pneumonia, these alveoli are filled with fluid made up of bacteria, pus, blood, or fluid. And this fluid substance is called, within the alveoli, is called consolidation. And it's due to infection, the inflammatory process that occurs within the lungs. In pneumonia, we get consolidation of the lung, parenchyma. In bronchopneumonia, similar things are happening, except the site of consolidation is really mainly along the airways, the bronchioles. And this can later move towards the alveoli eventually, leading to lobar pneumonia. There are many causes of pneumonia. They can be viral causes, bacterial, parasitic, or fungal. We will talk more about the etiology or the causes of pneumonia later on in this video. The next question is
nursing application. Control of vital signs, semi-folio bed rest, oxygen therapy, antibiotic established according to criteria. The prescribed antibiotic should be administered ideally within the first 4 hours of the diagnosis. Pros and cons. Pros: smoking, chronic disease, malnutrition, overweight, alcoholism. Cons: as antibacterial spectrum that includes gram-positive, gram-negative. Apply the BCG vaccine to the newborn. Take the prevention symptomatic treatment of fever and pain.
Inflammation in your lungs caused by an infection. You have 2 lungs, one on each side of your chest. Each lung has separate sections called lobes. Normally, as you breathe, air moves freely through your trachea or windpipe, then through large tubes called bronchi, through smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Your airways and alveoli are flexible and springy. When you breathe in, each air sac inflates like a small balloon, and when you exhale, the sacs deflate. Small blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe passes into your capillaries. Then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale.
Conclusion. Octacicline was not inferior to moxifloxacin for the treatment of community-acquired bacterial pneumonia in adults. Thank you.